Pelvic health treatment, as with every other type of PT treatment, starts with the PT evaluation. So the PT is going to get a lot of subjective information from the patient, gynecological, musculoskeletal, surgical, digestive, bowel and bladder history. They're going to screen for bowel and bladder function because if bowel and bladder function can be a symptom of pelvic floor dysfunction, it can also be a symptom of other things like neurological dysfunction. So the PT is going to bring that all into the evaluation. They're going to observe the patient's posture, breathing pattern, their ability to perform a pelvic floor contraction. They're going to do a trunk and lower extremity examination, including manual muscle testing, range of motion, single leg stance, functional assessments. They're going to do a pelvic floor examination performed by observation, external palpation, the surface EMG, real-time ultrasound, and sometimes an internal muscular assessment. As PTAs, of course, we don't do that. For PTAs, what we need to do is we need to review the PT evaluation findings. We need to understand what the baseline measurements mean. We need to be able to monitor patient progress indicators. What are we looking at to know if the person's improving? And we need to recognize changes requiring PT consultation. Common assessment tools for pelvic health include the PFDI 20, which is the pelvic floor distress inventory. It's a questionnaire that the patient fills out. The International Consultation on Incontinence questionnaire, that one is specific to incontinence. Visual analog scales for pain, functional movement assessments. The Cozy pelvic dysfunction screening protocol you can use for a patient that maybe they're not seeing you specifically for pelvic floor, maybe they're seeing you for low back pain, but you're thinking maybe it might be pelvic floor related. That can help screen, and we'll talk a little bit more about that a little bit later. So one of our main functions in pelvic health as PTAs is doing exercise therapy. So pelvic floor muscle training, proper cueing for muscle activation, progressive strengthening protocols, coordination training for contract, relax timing, and functional integration exercises. So we might be having someone working on a balance exercise or a TRX exercise where we're working on coordinating pelvic floor contraction and relaxation with the functional exercise that they're doing. So there are lots of different things that we'll do in the lab. We'll try out and you'll see how you feel about those exercises. They're pretty cool, a lot of them. Actually, core stabilization is something that we'll do not just with pelvic health, but with a lot of different areas of physical therapy. So diaphragmatic breathing coordination, transverse abdominis activation, multifidus strengthening, and whole body integration of all of those things. So that's just right in our wheelhouse. That is something that we do with a lot of people, including people with pelvic health issues. So for exercise progression, we're going to start with basic awareness of the pelvic floor and then progress from, usually we start in supine because that's a gravity eliminated position. We might even start with the pelvis elevated because that is a gravity assisted position. We'll try it in lab with different positions and try different exercises and see how they feel. You're going to progress from those supine and supported positions into upright positions and add in functional movements, including endurance and power components. So the basic pelvic floor exercises are usually called Kegel exercises. That's contracting the pelvic floor. Contract, hold, relax. Coaching proper technique, and we'll do those in lab. Quick flicks for fast twitch training because it's 70% slow twitch, but there's still some fast twitch in there. Sustained holds for endurance and reverse Kegels for relaxation. So the reverse Kegel is where instead of pulling the pelvic floor up and in, you're pushing it out and down, basically. So a lot of times people can do a Kegel exercise and contract the pelvic floor up and in, but they have a hard time relaxing the pelvic floor. And that can lead to a lot of pelvic pain syndromes. So some functional exercises that you might do, squats with pelvic floor coordination. So as you go down, you contract the pelvic floor. As you go up, you relax the pelvic floor. So cueing that and getting the patient to feel how that feels. You could also do it the opposite. As you go down, you relax the pelvic floor. And as you go up, you contract the pelvic floor. You can do bridge exercises, timing pelvic floor contractions with the bridges, modified planks and stability work, and gait training with core activation. So these are all things that we might be doing with any patient, not just with someone who's in for pelvic floor dysfunction. Equipment-based exercises include stability ball exercises, resistance band training, balance training tools, functional movement patterns. You see the person in the picture using a TRX. That's a great TRX and a balance pad, and they're doing single leg stance. So lots of functional stuff going on there. So all your creativity and using your equipment, bring it in. Bring it in. We want to use all that stuff. Um, the manual therapy techniques we're doing external, because that's where we are as physical therapist assistants. The appropriate external techniques include myofascial release of the hip flexors and glutes, trigger point therapy for the external muscles, like we talked about, piriformis, obturator externus, joint mobilization, maybe sacroiliac and coccyx mobilization externally. We've done sacroiliac and coccyx evaluation in your manual therapy lab, and so we might bring that in. Scar tissue mobilization, if somebody has external scars like cesarean scars or any other type of scars. I've worked with male patients with prostate surgery scars, doing scar mobilization. I've done scar mobilization with people with instrument-assisted soft tissue mobilization post-surgical scars, and those can be so helpful. The precautions that we want to look at when we're doing manual therapy, obviously, we always want to maintain appropriate draping. We want to explain the techniques before performing them. You want to obtain consent for each intervention, and you want to stop if the patient reports discomfort. Well, obviously, those precautions go for anything that we're doing, not just for pelvic health. We're going to document the specific techniques we performed, the patient response and tolerance, any modifications we made, and progress towards their functional goals. Under the direction of the PT, we might be setting up biofeedback equipment. So there's external electrode placement, and it's a little device that looks like a little TENS unit sort of, but you put the electrodes on and it gives you a visual and auditory feedback for when you're activating muscles. So you can use it for other muscles too, but for pelvic floor muscles, you can use them. And it helps to train proper coordination patterns, and it gives someone visual and auditory feedback of when they're contracting the muscles. So we might be instructing the patient on how to use their home unit and how to monitor their results from the biofeedback. We might be using some electrical stimulation, neuromuscular electrical stim, some pressure biofeedback units, different apps for home exercise compliance. That's useful, and bladder training timers. So sometimes when someone is coming specifically for incontinence, the PT will ask them to do a bladder diary, and they keep track of what they eat and what they drink, and when they void their bladder, and trying to figure out the relationships between those things. As a PTA, we're going to set up equipment as directed by the PT. We're going to monitor the patient response during sessions. We're going to troubleshoot basic technical issues like electrode placement and whatnot, and machine setup. And we're going to document the session parameters and the outcomes. So not that different from what we do in other areas.